Osteoporosis is a condition that affects millions of Americans. Today I will be discussing this important topic with Dr. Niall Roche, who's the Director of Rheumatology at Valley Care. Thank you for joining us. I'd like to start just by asking you to define exactly what osteoporosis is.
Osteoporosis is thinning of bone. Now, we all know that as we get older, our bodies change. And just as we change on the outside, there are changes inside the body. Perhaps one of the most important changes that occurs that we're not aware of is that our bone structure changes. And I would think of the bones as being basically like the foundation of a house. And as life goes on, that foundation can become damaged in various ways. It becomes thinner. It's a bit like termites that affect the structure of a house. And obviously all the other body, it's the structure of the house, so when that's gone, it has changes throughout the body. During life, the bone is very dynamic and very active. We normally think of bone as like we see in a skeleton, where it looks very inert, very solid.
Exactly,
but it's actually a very dynamic part of the body. If we could just take a look at a moment of what normal bone looks like, it might be easier to understand what's meant by osteoporosis. Now, on this part of the slide nearest me, you're looking at normal bone. And I think it's worth noting that even in normal bone, there are cavities in the bone. And this, of course, is where the bone marrow is.
I didn't actually realize that.
Yeah, and it allows the bone to be light and yet to be very strong. However, if we look at the portion of the slide nearest to you, we see that a lot of those, what are called trabeculae, the structural elements, are worn away, and in certain places there's actually discontinuity. These are called microfractures. And if you get enough of these, eventually you get a real fracture, like, for example, breaking your hip or breaking your wrist.
Okay.
And it can also happen in the spine, where you get compression fractures. So occasionally you hear the term a little old lady. Well, it probably means that she's compressed several of her vertebrae, and therefore she's lost height.
I see. Now, what's the difference between osteoporosis and osteoarthritis?
Well, that's a very good question, a question I answer almost every day, because there's some confusion here. Whenever you have the ending itis in medicine, it means inflammation of. So if I say tonsillitis, it means inflammation of tonsils. Dermatitis means inflammation of your skin. Well, osteoarthritis means inflammation of joints. Now, in the case of osteoporosis, it's not something that happens necessarily around joints, it's really what's between the joints. So osteoporosis affects the entire skeleton, whereas arthritis affects the joints, which are the movable parts of the skeleton.
And when someone has osteoporosis, do they have it in the bones throughout their body, or like osteoarthritis you can have in your wrists or in your hands? Does osteoporosis work the same way, or is it typically that it's covering your entire body when you have it?
It affects the entire body, and certain areas we know are particularly prone, for example, the hip, for example, the vertebrae and the wrist. And these are the areas that we use when we screen. We'll talk about that in a little bit.
And why are those the areas that are most affected in the body as opposed to your leg bones or your arm bones?
Well, I think any part of the body that's bearing weight. It's not so much that there's more bone lost, but if you're carrying more weight, then there's more pressure on that bone. So in fall or something, it's more likely that's the area. You'll give way at your area of most weakness.
I see. So what segment, I've always assumed that osteoporosis is kind of an older person's disease. Is that correct, or can it affect younger people as well?
Well, actually, osteoporosis can affect anybody at any age. Even children, for example. It's a little disconcerting.
It's a little disconcerting.
Yeah. Now, generally, there are special cases. For example, if children have a condition which, let's say, a child who has cancer who needs chemotherapy, they can develop osteoporosis. If they don't get enough calcium and vitamin D to begin with, they can have thin bones. But generally speaking, it's a condition that affects older people. And some of the confusion, when you mentioned about the difference between osteoarthritis and osteoporosis, some of the confusion arises because it affects essentially the same population. So the older patients who indeed have arthritis are the same patients who have osteoporosis. It's a common condition. It affects about 44 million Americans are at risk.
Wow, I didn't realize it was
very common. 10 million people have actual osteoporosis, and about another 34 million have the stage before osteoporosis.
Which is called?
Which is called osteopenia.
Okay.
So you have normal bone, osteopenia, and osteoporosis.
And is it, I've heard before that, that everybody at some point, if they live to be 100 and something years old, is going to get arthritis, is going to get osteoporosis. Is that accurate?
That is true. But fortunately, there are a lot of things you can do to prevent that progression.
Let's talk about that. What can you do? Well, actually, let me back up just a little bit. You mentioned before that the body was laying down bone.
Yes.
At what age do you stop laying down bone and start losing bone matter or bone mass?
I think the best way to understand the balance between bone and your diet and intake of calcium and such things is to understand that as you're growing, you're naturally increasing the amount of bone. In other words, the amount of calcium you take in every day is greater than the amount that you lose. We lose a little in the urine every day. So as you're growing, and until about the age of 30, you're laying down, you're continuing increasing your bone mass. When you reach the peak, that's called the peak bone mass, that occurs for most people around the age of 30. But we know certain things can influence that peak bone mass. For example, if children eat a healthy diet and if they exercise, they have stronger, better bones. So there's more, if you like, in the bank. So you could look at it like a retirement fund for the bones. The more you put into your retirement fund, the more that's there for when you may need it later on.
Okay. And these foods that the children should be consuming, I mean, milk's kind of a given. I would imagine cheese and a lot of dairy. What else can you find these calcium?
Leafy green vegetables, and
Really?
fortunately several products, for example, orange juice often contain vitamin D, which helps to absorb the calcium. So there are a lot of places you find calcium, but for some people that's not enough. They really should be taking some additional source of calcium as well.
And how do you know if you're one of those people that should be taking additional calcium, or if you can just imagine that your own diet's taking care of it? Is that a doctor prescribed thing, or is that just a logic?
Well, I think when it comes to that, I think we should begin perhaps with some basic things that everybody should be doing anyway, and then perhaps look at what things you can do as extras. So the basic things, well, you asked who gets osteoporosis, who's at risk. The risk factors are, first of all, unfortunately being a woman is a risk.
Great, okay.
If you're a woman who is menopausal, that's when a lot of the bone is lost. Certain race is a factor insofar as if you're Asian, for example, you have less bone than if you are Caucasian or African American.
Oh, I didn't
so it
realize
affects
that.
your peak bone age. Men, of course, get osteoporosis as well, but much less so because they're generally bigger and they have more calcium to begin with. Genetic factors are important. We know that hereditary is a factor. If you have a family history of osteoporosis or a family member has broken a bone due to osteoporosis, that increases your risk. So it's like any condition from diabetes to heart disease. If it's in the family, your risk goes up.
Now, you indicated if someone has broken a bone from osteoporosis, how do you know if they've broken a bone from osteoporosis as opposed to from a fall or from an accident or something along those lines?
Well, the fractures that occur in osteoporosis are sort of typical, and the areas where you tend to see these fractures would be, for example, the hip or in the spine or in the wrist. They're typical locations, so you'd be thinking about that. And also, if there was not a lot of trauma, sometimes the history will tell you, because sometimes people say it's not so much that they fell and broke their hip, but they broke their hip and they fell.
I see.
Now, speaking of risk factors, a couple of other things are worth mentioning, and that is that perhaps the single biggest risk factor is being sedentary. If you don't exercise your body, then your bones get weaker. And every time you exercise, your bones feel the strain. For example, when you lift weights or when you run, your bones feel the strain, and that gives them a message to lay down more calcium in those areas. And things like not smoking or avoiding excess alcohol are important. Certain kinds of medical conditions put you at risk. So, for example, if you have rheumatoid arthritis or lupus, or if you have any kind of cancer, which especially if it involves treatment, which might include steroids for that, or Parkinson's disease or a stroke, essentially any condition which limits mobility increases your risk of osteoporosis.
I see. And it's interesting. People think of working out and they're helping their muscles. They don't really think of I'm working out and I'm helping my bones.
And they are. They really are. It makes a huge. And at any age, the good news is at any age you can delay the process or reverse the process. And one final risk factor I think I should mention is medications. That some common medications, for example, antacids, especially aluminum-containing antacids, Prilosec, things which interfere with stomach acid can change the amount of calcium absorbed. Steroids would be a very common reason, especially if you're on a high dose for a long time. And certain other drugs like lithium and things like Prozac can actually have an effect on the bone. So I think just be aware that if you're taking medications, it's worth asking your doctor, is this likely to increase my chance of getting osteoporosis?
And if it is, can you balance that with taking calcium supplements, with taking vitamin D supplements?
Yes, and I think just if you go through the risk factors, it appears immediately that there are some risk factors you can't change very easily, like if you're a man or a woman.
Or heredity. Yes.
Or heredity. These are givens, or if you have a small frame. But the other things, for example, exercise is an excellent way of delaying the onset of osteoporosis and can even reverse it.
Okay, so if you are starting to get, you called it osteopenia, kind of the early stages,
yes,
you actually can kind of help yourself and prevent it a little bit
yeah,
from going
I would
further?
think the minimum amount of exercise is about 30 minutes walking every day. That actually helps your entire body, even though it's primarily the legs, but it actually changes the muscle structure and the bones in the entire body.
Okay. What about weightlifting?
Weightlifting is good in moderation.
Okay.
I think you got to be careful. Many people, they hear what's essentially good information, but the problem is that they don't allow the body to adjust. The great thing about the human body is it's so dynamic. It changes over time. It adjusts to what you do, but you have to give it time. It's like training for a marathon. You know, if you begin slowly. I heard actually this weekend that a man of 100 ran a marathon. I was amazed.
Really?
And I think it should give all of us hope that there's, age itself is not a limiting factor.
Okay. Let's talk a little bit about the treatment of osteoporosis. So someone's being diagnosed, they have osteopenia, they've exercised some, they've improved their diet, they still progress slowly into osteoporosis. What can be done for them to maintain their quality of life?
Well, there are actually a number of things that you can do, but perhaps just before that I might talk for a moment about how we know who's got it.
Okay.
And people often say, well, what are the symptoms? What sort of things would alert me that I have osteoporosis? And unfortunately, in many cases, there are no symptoms. And this is why we're trying to increase awareness, because people may not know that they actually have osteoporosis. And it could be quite advanced before it comes to their attention through a fall or a fracture. So if you know you have a risk factor, and we talked about those just a moment ago, if you know you have a risk factor, and in any event when you're in for a routine doctor's visit, it's a good idea, certainly for women as they turn 50, but as they turn 40, and for men as they turn 50, to ask your doctor, might I have, and then they will talk about lifestyle and your risk factors, and they may refer you to a bone density study. And we're fortunate that we have state-of-the-art screening, which is basically a DEXA scan. And
I think we actually have footage of someone having a DEXA scan.
It's a simple test, and it's basically a very low-dose, non-invasive, very low-dose X-ray exposure screening test.
Okay, if we can please go ahead and roll the footage.
Hi, my name is Janet. I'm one of the X-ray technologists here at Valley Care, and I perform bone density scan. And what we're going to do here is demonstrate how we do a bone density scan of the back. I'm just going to center this, and when we do the scan of the back, what we do is we raise the patient's legs, we get them in position, we scan them, come over here to the computer, takes a few minutes, and we're all finished. It's that easy.
So is it really that simple? Is that the test?
That's pretty much it, yeah. Now, when they've made the image, that image is sent back to your doctor, and it's determined from those images what your bone density is like. And when they measure certain parts of the body, we know from studies that this gives an excellent indication of what the entire skeleton looks like, because we're looking at the weak spots. And if they're good, then you can assume that the rest of the body is fairly good.
I see.
Yeah.
So let's say they're not. Let's say someone takes a look at this test and says, you know what, this is someone who's either got osteopenia or they've progressed and they now are beginning to have osteoporosis. Then what happens?
Well, again, we go back to the basics and we start looking at the patient's lifestyle. You obviously ask questions about their exercise program. We ask about their dietary intake. Now, it so happens you can get enough calcium from your diet, but unfortunately calcium, as you mentioned earlier, often comes from foods that contain other things. So, for example, if you eat enough cheese and milk and ice cream, you can get plenty of calcium. The problem is you're getting a lot of fats as well, which you might not like to have. So for patients who have osteopenia or osteoporosis, we'd recommend that they take supplements in those circumstances. It's the best way to improve the amount of calcium they get. For the absorption of calcium, it's essential that you also get vitamin D.
What kind of vitamin D do you need to take?
There are many, many kinds. If you go along the supermarket shelves or wherever you see, or the pharmacy shelves, you see a lot of different types. What you need to get is vitamin D3. Now, the purpose of vitamin D is to help you absorb calcium. And this is another common mistake people make. They may take calcium or they may take vitamin D, but they don't take both. The purpose of the vitamin D is to allow the body to absorb the calcium.
I see. Now, isn't vitamin D also found, I mean, just from being out in the sun?
Yes, you can. And I think many people come in to me and say, but I'm out in the sun, I'm in my garden, I do this, do that. But they don't realize that they may not be getting enough vitamin D exposure, enough sun exposure to create enough vitamin D in the skin. And secondly, again, we worry that if you get enough sun exposure to have adequate vitamin D levels, perhaps you're not only going to get wrinkles, cancer, but you might get skin. So we're trying to balance. So I think because it's such a simple thing to do, taking a supplement, and the correct form that the body likes to absorb best is vitamin D3. Vitamins are both water-soluble and fat-soluble. Vitamins A, D, E, K are fat-soluble. And I mention that just because when you're taking vitamin D, it's important that you take it with a meal, especially if you have something like salad oil or there's meat or something, so there's some fat there. Mm-hmm. If the vitamin D is better absorbed, if the vitamin D is better absorbed, then the calcium is better absorbed.
I see.
So they're the first steps.
Okay, and what age should someone just start taking calcium? I mean, is that a 20-something, a 30-something, a 40-something?
I think that taking calcium certainly from about 35. We know you peak at 30, so I would say begin perhaps only taking one calcium pill a day around the age of 35. But there's quite a marked bone loss in women after the menopause. So I think that if they increase their calcium at that time, and of course with vitamin D, that they're going to benefit from that. It's prevention, which, as we know, is the best form of medicine.
Okay, great. Now, so we mentioned that you can do some things to kind of, to reverse or at least to slow down your bone loss. Calcium and vitamin D and exercise and all are the biggest things. Let's say someone's fairly far progressed, doesn't really want to exercise, doesn't care to exercise, doesn't want to change, and I'm sure you have a number of patients who've come in and, hey, I am who I am, and it's this far, and now what do we do? I mean, is it great if you can't take surgery, or you can't have surgery to improve this disease,
obviously if you have a fracture, then you will need surgery, but I look on that as pretty much the last resort.
Okay.
You mentioned, I think once people understand, I think exactly what's involved, then they change their behavior automatically. And for those who find perhaps whatever, or perhaps people who are unable to do things like, for example, if they've poor eyesight, so it's difficult to go for walks, in those cases you can always do something. And for example, it might be as simple as having an occupational therapist visit your home and check that there are no trip hazards, that there's nothing, that there are no cords or rugs throw rugs that might slide, or that there's somewhere to hold on to things, that there's clear access. These are things that, small things that can actually make a difference. And if you can improve, you see an ophthalmologist, get your glasses updated so you can see where you're going. Of course, if you don't fall, then you're at less likely of getting a risk of fracture as well.
I see. So, and then how do you treat osteoporosis? I mean, there are drugs to treat it?
There are drugs to treat it. Now, obviously, these drugs depend on having done the first things, like, for example, taking calcium with vitamin D. Mm-hmm. They're, again, the most important things. Once you've done that, now you've got calcium in your bloodstream. And the question is, how can you make it go to the bone? We talked earlier that the bone is very dynamic. Every day, some bone is broken down and new bone is laid down. And in order to allow the calcium to go where it needs to go, there are drugs particularly called bisphosphonates, which have come along recently, which go to the bone and they hold on to the bone. They prevent the bone cells, which would normally break down the bone, they prevent them from doing so. So the amount of bone actually increases. So not only do you prevent the progression, but you can actually to some degree reverse osteoporosis. And this can be done, by the way, at any age. It's an important message. In addition to bisphosphonates, and I just mention a couple of names because some people may be on them, things like Fosamax or Boniva, Actonol, these are the kind of things that would do that. The second line is hormone replacement therapy or hormone-like drugs. Now, we used to recommend hormone replacement therapy because obviously hormones change after the menopause, and we thought, well, if you give back those hormones, you can reverse the process. You can, but you run into the problem of unintended consequences. It turns out, for example, heart attacks or strokes.
Okay.
So, and the incidence of certain kinds of cancers can be changed. But there are new drugs which are called SERMs. These are selective hormone-like replacement hormone modulators, and they're selective estrogen receptor modifiers. And these can help to reverse, they cause many of the benefits of hormone replacement therapy without the side effects. a stage beyond that again would be to use something that for more severe cases would be to use a natural hormone in the body. There's a hormone called parathyroid hormone, which is very important in calcium regulation, and this can be given now basically it's as an injection that you give yourself every day for about 2 years.
That sounds like a pretty intense treatment.
Well, it only takes a few moments, and like diabetics give themselves injections every day, and I think if you weigh up the risks and benefits, people will do what they need to do to get better. But this is for minority patients.
Okay.
And then calcitonin, which comes sometimes as a nasal spray, it's another natural hormone which can help prevent osteoporosis, but also can actually be quite useful in controlling pain from fractures from osteoporosis. And finally, the latest drug is a thing called Reclast, or zoledronic acid, which is given by infusion once a year into a vein, and that can prevent. It's a way of ensuring compliance. So for certain patients, these are the right options, and it's really very individual. It's best talk to your doctor about it and see which one is right for you.
And when someone's at a stage where they have osteoporosis and they're looking into these kinds of drugs, are they beyond the care of their primary physician and they're now seeing a rheumatologist such as yourself?
I think primary care physicians are the people we rely on for many, many things. They're really responsible for your general health and preventing a lot of conditions. And many of my colleagues who are primary care physicians do a great job with this. But of course, there's a population of patients who either have a much more advanced stage of disease, or they can't tolerate some of the other treatments. So for those patients, they may be sent to myself, or they may be sent to an endocrinologist, for example. So we would tackle the more difficult cases.
I see. That's great. And Dr. Roche, is there any advice you'd like to leave as kind of a closing message to our audience?
Well, I think it's important to realize that this is a serious condition. It's a potentially serious condition. I don't know if you are aware, but about 50% of people who over the age of 50 are at risk of getting an osteoporosis-related fracture. If you fracture your hip, you have about a 25% chance of dying in the year following the fracture. So
why would that be?
Because your whole lifestyle changes. You become immobile very often. You undergo surgery, often not optimally, because you're found at 3 in the morning or something.
Okay.
And you may get an infection, there may be complications, and often it's a sign of other things that are going wrong in your life at the same time. So it's a serious condition, but as I mentioned, essentially, for most people it's preventable. At any age we can do something about it. Screening is simple, it's non-invasive, and finally, at any stage, treatment is available and something can be done.
That's great to know. And on that note, I'm going to go ahead and end our program. Thank you very much for sharing this information with us.
Thank you.